Welcome everyone to our CPR training session today. We will simulate the entire process of how to give a CPR, including chest compression, establishing an open airway, and defibrillator. First, we will need to assess the situation and the environment, ensure that it's secure and safe. Second, we're gonna see the patient and assess the patient. For example, hello, are you okay? Are you okay? Second step is checking for breathing. First, we will locate the Adam's apple. Second, go down to the growth and assess the pulse for 10 seconds.
Now I'm going to do the step 3, and the step 3 is chest compression. For this compression, it's important to place our hands in the center of the chest and push hard and fast. The location where I'm going to put my hands is in the lower sternum and in between the nipple area. And while we do the chest compression, our hands should be interlocked. Our hands should interlock like this, and the fingers should be interlocked, and the fingers should not touch the chest. It should be upright like this, and I should be vertical to the patient's chest. And remember to allow the chest to fully recoil between compressions, and aim for around 100 to 120 compressions per minute, and while the depth should be around 5 to 6 centimeters. Like this.
So for the next step, I'm going to do the opening the airway. For in this fourth step, I'm going to tilt the back of the head slightly and use my other hand to lift the chin up. In cases of when cervical spine injury is suspected, we do the jaw thrust like this, so that the airway is clearly open, and we see any kind of foreign materials inside the mouth, so that it's not blocked or obstructed.
For the next part, I'm going to do rescue breaths. After 30 compressions, I'll give 2 rescue breaths, and I'll ensure airway is open, and I'll pinch the nose, sealing my lips, creating an airtight mouth-to-mouth seal. Each rescue breath should be over 1 second, and we have to provide enough air to see visible chest rise.
Now I demonstrate the defibrillation. First, we turn on the AED machine and then place the pads on the patient. After placing the pads, make sure no one is touching the patient while the machine is checking the heart rhythm. If the shock is needed, press the shock button. After administering the shock, I start the CPR immediately.
For the next step, we will do 30 compressions and then 2 breaths.
Multiple rescuers should rotate for every 2 minutes.
Two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 16, 17, 18, 19, 20.
Everybody clear?
We will start the recovery position as soon as the patient starts breathing on itself. For doing the recovery position, first we have to ensure a good airway so that the tongue does not cause any obstruction. The first step is that the hand which is closer to you, we should make it on the right angle, for example like this, And the second hand, we have to bring it under the patient's face, like this. And the knee should be like upright, and then we need to try to move the patient like this, to the side. This is how we do the recovery position.
Great job, everyone. Everyone did a very good job. Remember, the key steps in performing a CPR are to assess the situation, call for help, open the airway, perform chest compressions, and use the AED when necessary. So, yeah, practice makes perfect.
Thank
Thank you.